So I'd like to welcome everyone to the Health Coalition of Passaic County's third Health Equity Roundtable. My name is Kim Birdsall, Executive Director of the Health Coalition of Passaic County. We're an organization that is comprised of over 80 partner organizations dedicated to addressing the social determinants of health and advancing health equity. As an essential Medicaid partner and one of 4 New Jersey regional health hubs, we work to be the bridge between clinical needs and community resources, and also to elevate community voice. We believe the best way to achieve health equity, where everyone in our communities has the same opportunity to live healthy, happy lives, is by really understanding and addressing all of the factors in our environment that impact well-being. These factors are often referred to as the social determinants of health. And a critical component of health is insurance coverage and access to health care, which will be the focus of our time today. Specifically, we will be discussing insurance coverage and Medicaid renewals in light of the end of the public health emergency. With the end of the COVID-19 public health emergency provision, we are facing a massive undertaking requiring redetermination for all Medicaid recipients in order to confirm their eligibility for coverage. Before the pandemic, redetermination was a standard practice with important but not transformative implications. However, in the shadow of this most disruptive public health crisis that has occurred in a century, where millions of people and more individuals became eligible for Medicaid, this year's redetermination effort is particularly challenging and stands to produce profound and long-term health, financial, and societal consequences. According to the Kaiser Family Foundation report, since April of 2023, more than 6 million people across the country have lost their Medicaid coverage, and millions more are on the brink. And that fallout of so many people losing healthcare coverage really could have tremendous impact. It could result in the overuse of emergency rooms, escalating healthcare costs, poorer health outcomes, diminished support for healthcare providers, and higher overall administrative costs. But organizations that you'll hear from today, including the Health Coalition of Passaic County, are working closely with our state and federal agencies and community-based partners so that we can raise awareness and offer help to folks through this redetermination process. You know, this is really so important because we know that equitable and quality healthcare is a prerequisite for vibrant communities. Healthier adults are better equipped to hold down jobs, contribute to the economy, and be better caretakers. And healthier children are more likely to thrive in school and become the best version of themselves. So for today's webinar, we're going to start with a 30-minute discussion that explores Medicaid redetermination in New Jersey and understand the key lessons we can take away from this process. Following that, we'll move into our Q&A session where the audience can ask questions and gain insight from our expert panelists today. Please feel free to use the Q&A function at the bottom of the Zoom window, and we will do our best to address as many questions as possible. So because of their work in healthcare policy, clinical practice, and direct community engagement, our panelists today bring a deep and wide-ranging understanding of the impact of health insurance and Medicaid coverage on overall health and well-being. Our panelists for today's discussion are Linda Schwimmer, President and CEO of New Jersey Healthcare Quality Institute. Linda leads the New Jersey Healthcare Quality Institute's vision of a world where everyone receives safe, equitable, and affordable healthcare. Dr. Janelle Hall is Executive Director of the United Passaic Organization, and Dr. Hall leads the UPO, which provides wraparound services to families in need with the end goal of helping them reach self-sufficiency and eradicate poverty in Passaic and beyond. And Joan Darsnet is the Director of Care Management Department at St. Joseph's Healthcare System and brings her perspective and wealth of knowledge in regard to care coordination and care management. Thank you all so much for joining us today. That was a lot for the intro, so let's get started. The first area that I'd like to kind of discuss with all of you is if we could start for the audience to gain a better understanding of Medicaid redetermination in general. And so Linda, I'd like to start with you. Could you provide just some insight for the audience about what redetermination is and why this is happening?
Great. Yes, and Kim, thank you so much for having me. It's a pleasure to be here this morning talking about this important topic with all of you. Yes, so the so-called Great Unwinding or redetermination process is an unusual one. At the beginning of the pandemic, when a public health emergency was called the federal government saw that a lot of people were losing their jobs at the time, and we were in the middle of a pandemic, which is a time when it's really essential to be able to have access to healthcare and all kinds of treatment. And so as people were losing their jobs, they were also in certain instances losing insurance and applying for Medicaid. And they also wanted to make sure that people who already had Medicaid could stay on Medicaid. So what the federal government did was they offered all of the states more money in their federal match towards Medicaid. The Medicaid program is a joint effort between the states and the federal government in terms of how it's funded. But in return for that extra federal funding, the states had to agree to what's called a maintenance of effort, which means that they had to keep everybody who already received benefits through Medicaid on Medicaid. So back in December of 2019, we had about 1.7 million New Jersey residents receiving benefits through Medicaid. Today, we have close to 2.3 million people out of our almost 9 million, just to keep that in perspective. So pretty big increase, over about 600,000 people, which is unusual because usually people cycle on, people cycle off just based on changes in life events and circumstances. So now that the public health emergency is over, we are in the process of going through this redetermination. Everybody who is a Medicaid recipient has been divided. The big pool has been divided into 12 different pieces, 1/12, and each month a different group of people will be receiving a package, and then phone calls and postcards and then follow-ups, and they have a designated period of time to fill out the paperwork, to have their status redetermined, and that is how they will stay on Medicaid. And I'll pause there because there's a lot more to it, but that's the general overview. Oh, you're on mute.
Thank you so much. Yeah, one day I'll figure out the mute. Thank you so much, Linda. That was a great overview. It's really a tremendous undertaking, as you explained. From your perspective, and I'd also like to bring in Janelle and Joan in this question, but I'd like to start with you, Linda. Do you see what are key challenges that you're hearing that are facing individuals or families during this process?
Well, so a lot of these families or just individuals, they're not used to this process of redetermination. Some people were on Medicaid for the first time in their lives during the pandemic. The timing is different and new to them. So it's going to be a massive education process. The other big issue is because it's been so long, normally a redetermination, depending on what type of Medicaid you have, would be either every 6 months or every year. It's been almost 3 years now, and people move around a lot. And then the pandemic really upended a lot of people's lives in different ways. And so that exacerbated the situation. So the information that the state or the health plans, or which are also called MCOs or Medicaid care organizations, managed care organizations, the information that they have on people may be incorrect or more incorrect than it is normally. So finding the right information, having the right cadence, unfamiliarity, these are all things that are making this a challenge for everyone.
Thank you so much. Janelle, I'd like your perspective as a community-based organization partnering in this work. Would you like to share some of the challenges that you're seeing?
Excellent. Thank you so much, Linda. I must say, you took the words right out of my mouth. We didn't even speak about this, and you targeted the same words and responses I was going to share out. There were a lot of confusion regarding the eligibility. There were questions about, okay, if I don't qualify, do my children qualify? The understanding about the application process. But I must say the positive was the hands-on assistance, the in-person assistance, and able to get someone on the phone, a warm transfer to the state, or getting someone on the line. That was very, very helpful in their experience during this process. But definitely a lot of the issues or challenges was that the eligibility process of the application, confusion about what is going on, where is the packet, how do I get my hands on the packet, and so forth. So having this opportunity to be the boots on the ground help limit some of these challenges by being well versed in what's going on and being educated and being the expert to help during this time when there's despair because they're afraid of losing their health insurance. And we were able to calm that storm for them and provide them with the information that they need to help keep them insured and their families insured. So that's basically how the boots on the ground, how we implement it and try to take over the rise of the challenges.
Thank you so much, Janelle. It's such important work, and partners like yours who are so close to folks within the community and trusted among the community members are really critical to help get the right messaging out and connect people to the right places. So, unfortunately from national reports, we're really hearing, as I shared in the intro, that millions of people are unfortunately losing their healthcare coverage for various reasons. And so I'd like to turn to Joan, just from your perspective in care management and coordination. What are some implications that you would say could be put in place if so many people do lose their health coverage or their Medicaid benefits?
Yes, well, thank you. I just want to say thank you for having me on this panel. I'm very grateful for the opportunity to speak to this. One of the things before I even just go into this is I just want everyone to think of a time when you had a medical event where you need to be serviced by a healthcare in the healthcare system. And just think about all the people that touched you and all the things that you needed. And at that point, most people have insurance. Most people, I'm assuming, on here have insurance, that you didn't have to think about anything related to how am I going to pay for this? What are the implications if I can't pay for this? Everything kind of seemed to run smoothly. But if you think about every person that touched you, everything that you need to do, from follow-ups to medications to physicians, did you need surgery? Did you need to go to the ED? Did you need a hospital stay? All those things are stressor events and can add up. So for our patients here that have Medicaid, they rely on that because that's a huge resource for them. When they lose that, it kind of gives them really no resources within the community. It's very difficult for them to be able to maneuver. A loss of coverage creates a delay in care. It's less preventative care for patients. It decreases use of prescription medications. There was a study that showed loss of coverage increased ED visits and hospitalizations by 36%, and a decreased use of prescription medications by 19%. When people do not have the resources and the support for healthcare, a lot of times they do what's called healthcare ration. They ration their healthcare. So maybe I don't need to see my cardiologist this month because I'm feeling good, or I'm supposed to take 2 tablets of this medication, but I may just take 1 because I'm feeling good, or I may just skip today. And that causes a lot of healthcare implications and complexities, and causes a lot of acute events for some of these patients. These acute medical events wart hospitalizations can increase length of stay. A lot of times they don't have the resources at home and a safe discharge plan, where now families are going to have to pay out of pocket for equipment. Just some examples for what the expenses would be. If they needed a bedside commode, that's $50. A walker is another $50. A shower chair is $40. If I need oxygen to rent it, it's $150 a month. Even if I need to go on a medication I can't pay for and I need it, there's a medication called Eliquis that a lot of our patients, our cardiac patients and our stroke patients, have to take. That's $425 a month. So those expenses cause an undue burden on families and our patients. We rely on families in the community to take care of these patients if we can't get them to a next level of care, such as a rehabilitation facility or a nursing home. Now, these families who have social issues not a lot of income. We're now asking them to figure out, you have to work to care for your family, but you need to take care of this loved one at home because we have no place to send them to. So there's a lot of things that come into play and a lot of challenges within this. I have a story of a young oncology patient that we had here who had insurance, that was discharged, was supposed to follow up with a oncology physician. It was a private pay not private pay, but a private physician that took insurance. The young man lost his insurance, didn't know where to turn to, was without treatment for his cancer for 6 weeks till he wound up in the hospital. We were able then to reconnect him to our clinic and our oncology social worker, who was able to then get him back up and running with insurance and get him connected with the clinic and the treatment. But here's a person that kind of got lost in the shuffle and lost 6 weeks of chemo treatment for his cancer. So those are just some of the implications and things that can happen when we have patients that don't have insurance, or have insurance and lose it and don't realize that they don't have it anymore.
Oh, thank you. Really just heartbreaking stories and situations, and it's a really difficult time. I know for members of the community where we serve and where we work, given all the rollback of lots of things that were put in place during the pandemic. So, raising awareness, I think that redetermination is happening and helping folks understand what they need to do to have a timely response to ensure that if they are eligible, they continue to receive insurance, certainly was highlighted here by Joan. Janelle, you're really helping us raise awareness in the community. You and your team really are boots on the ground. What type of feedback are you starting to hear from people in the community? I think initially a lot of folks didn't know this was happening, but maybe more folks are aware now. Can you just talk a little bit about what you're hearing from folks in the community about their redetermination process?
What I'm hearing, thank you for the question. What I'm hearing again is the preparedness. They weren't prepared because, as Linda stated, people move around a lot. And during the pandemic, people were not in their original homes when they originally applied for the Medicaid for New Jersey Family Care. So with that, they never received that information. So they did not have that preparedness, that timeliness of information, so they can execute properly to reapply for their health benefits. With that said, when we came out boots on the ground with this information, they had no idea they had to reapply. No idea. So it was absolutely deer in headlights. They had no idea how to do so. So we made even office hours to have clients come in, which took about an hour. Some of them had paper applications they brought right in, and they didn't understand it. So there was some understanding of language as well, because they did not understand how to read the application. So it was very step by step that they needed that assistance to complete the application. So the delivery of the rollback was some of the feedback, how that information was received, being that we were the first point of contact, that they knew this had to be done. Also, again, understanding the policies, what is it that they needed to do to keep the entire family covered? Okay, now if I have a job now, can my children stay on the insurance? So the feedback from our clients, it's just that they would like this more hands-on clinic type one-on-one assistance to keep this their insurance active and live and no gaps of coverage.
Thank you so much. Linda, from your perspective, is there anything you'd like to add to or any guidance for what Janelle just shared in regard to what folks should or could be doing?
Yeah, no, thank you, Janelle. That really resonates with me. I was just on a call yesterday with the state and a lot of community advocacy organizations and community-based organizations in 2 other counties, Ocean and Monmouth. And a couple of key messages that we were all discussing is the state covered NJ website, and then they have the 800 number. That is, and they have the ability to make sure people have access to talk to somebody in multiple different languages, and they have the materials in in all of, multiple common languages spoken here in New Jersey. And there's a long list of those because that is a big issue. The other thing, our laws have changed since the pandemic too. For instance, for pregnant individuals now, they can stay on 1 year postpartum. At the beginning of the pandemic, it was still just limited to 60 days. So even little things like that are really important because that's a year of, all, not just perinatal care, but really, any type of care. So that's really critical care for somebody to be getting. And then the points that Janelle raised about whether or not everyone in your family is eligible, it's complicated. You can definitely have a job, but the rest of your family is eligible. You may still be eligible depending on what the terms of the insurance are. It might be that Medicaid is the wraparound insurance and the insurance of last resort, but you're still eligible to Medicaid as well. So when it starts to get more complicated than that, I think probably almost everybody is going to want to talk to somebody who's been trained. There's also community-based organizations out there in each county that have contracts with the state and are trained to help. So I think it's just making sure that you're reaching out to whoever your Medicaid managed care organization is, giving them your newest address or giving the state your newest address so you can get that packet. The other key thing that I learned recently is that even if you missed your window to reapply, you can appeal. And while you're appealing, your coverage stays in place. So you have several more months of coverage in place while that appeal is going through too, which definitely takes some stress off. And some of the things that Joan was mentioning about, not, having to avoid or cut your pills in half and things like that. At least it takes some of those stresses away.
Can I just add to that? Also, Linda, you made some great points. I like the fact to have someone contracted at the agency, perhaps UPO, to help with those more difficult situations that my team and I are unable to address, such as I'm working now. Do I still apply? Like, we probably cannot answer or address those questions because sometimes they will need a translator or they just do not understand or comprehend the process. So sometimes they need someone to advocate and speak on their behalf. A lot of our clients here. So having someone here, perhaps for like office hours or some sort, because we get a lot of people that come through our door, especially as a trusted source. And now that we're adding this to our repertoire to help individuals ensure that they're healthy and have insurance in place, that would be feasible, especially for a community action organization in the city.
Thank you so much.
And I was just going to say, Kim, and a lot of people will not be eligible anymore, but I think it's also really important to point out that they should then go to Get Covered NJ, which is our New Jersey individual market, which has both state and federal subsidies, which are very generous. I mean, up to 600% of the federal poverty level, you can receive a sliding scale of subsidies. So it's really important to just have that seamless transition. Just because you're no longer eligible for Medicaid doesn't mean that you're not eligible for subsidized insurance. And most people will be eligible for some level of subsidized insurance.
Thank you so much. There's just so many amazing pieces of information that you both shared, as well as Joan earlier. So I think what I'm hearing is, certainly folks should work with, we work very closely with the Passaic County, with the state, but are advocating folks to connect with the Passaic County Board of Social Services in our region or the 1-800 number at the state. We realize that there is a high volume of individuals trying to connect to both of those places. So I think the message is to kind of be diligent with it, keep trying, because the complexities do often require folks to speak with somebody individually. And to Joan's point about the importance of lack of health insurance, I think, Linda, I can't emphasize enough the point that you shared as well about going to the exchange, making sure you get coverage, that there is some level of affordability and affordable coverage to make sure that folks don't have a gap in care or services. We opened the discussion really talking about, before we jump in, I do want to remind the audience, if anybody has any questions, please feel free to use the Q&A feature and send those over, and we'll get to those shortly. We started our conversation about talking about healthcare access as a social determinant of health. Joan, what types of social determinant of health challenges, you mentioned a few of them, but do you see from your perspective about folks here in Southern Passaic County? And how does Medicaid coverage intersect with those challenges?
Yes. So social determinants of health actually drive healthcare outcomes. 40% of those are socioeconomic factors. So things like education, job status, social support, income, and community safety all take a part into driving healthcare outcomes. 10% are physical environment. The rest of the pieces are related to health, but the biggest, 50% of it is what people encounter in their environment in their day-to-day lives. From our perspective, from what I find dealing with patients who come into the hospital with acute medical issues, one issue is income and job status. I had mentioned earlier, sometimes we have patients that aren't able to be home on their own. They don't have the resources to cover going to a lower level of care. They obviously can't stay in the hospital. The only other option is home. Family may not be able to provide the support at home because they need to work to support their day-to-day, their rent, their food, their utilities. It causes a stressor in the fact that they don't have the income or the job that they're able to take the time that they need to care for their loved ones or their families, or even the money to bring somebody in, a health aide or a nurse, a private duty nurse, to come in to help take care of them. They rely on family, friends, and that kind of gets difficult and kind of muddy a little bit when we're trying to talk discharge planning with families. And then I had mentioned earlier, healthcare doesn't become a priority for some of these patients when it's related to how am I paying my rent, how am I getting food. Again, they end up rationing their healthcare. They skip appointments, they skip follow-ups, they may not fill their prescriptions until things get too bad and they wind up in the hospital. Even housing can be an issue. We do have some homeless population that do come into our hospital that have needs. Sometimes when they leave, they need visiting nurse services. We can't provide visiting nurse services to someone who's homeless, even if they're in a shelter. Visiting nurse service isn't going to come and see them. Even in an area that's considered an unsafe community, which we do have some where some of our visiting nurse services will consider escort areas. They need to go in with a police officer, security, someone to go with them. Sometimes there's areas they won't even go in with escort services, so that we can't provide visiting nurse services and the connection to the resources for these patients. And then education is important because there's a lot with health literacy. There's a lot to understand about what's going on with you when you have a healthcare event. And it's really important for healthcare professionals to be able to speak to those things in basic terms, which sometimes I think, and I can say I'm guilty for this as well, being a nurse, that sometimes we speak to it as we would speak to a professional, and we're not understanding that they may not have the same health literacy as somebody who's been in school for the medical profession. And so they don't always have a great understanding of the overall health picture, because I think sometimes the health literacy is not there and explanations may not always be to the level of the patient.
Thank you, Joan. So really what's interesting is we started talking about access and insurance coverage as a social determinant of health, but what I'm hearing is that many times other social determinants kind of take precedent over, just living a daily life takes precedence over that. Would that be fair?
Yeah, and just so I know, just Medicaid benefits does seem to intersect with some of those social determinants. Medicaid they have health transportation benefits. So if they need to go to a doctor's appointment, there is a program called Motive Care. Patients can call up to 24 hours before their appointment to have a transport to their medical appointment or their dialysis appointment. They're connected to navigators, health navigators, complex discharge planners to help them walk through issues within the community to try to keep them out of the hospital. We have an MLTSS program, which are for long-term care patients. It can keep them home and get them services so they can stay home with needs or put into a long-term care facility. And then there was also a program that we worked with HCPC, which is through Blue Cross, which has been a great program. We actually were able to work with the Blue Cross, and I think with you guys with HCPC for a family with quads, where we were able to get diapers and car seats. and things like that they needed for their newborns who they were bringing home, 4 of them. So those types of things are really great resources to help kind of mitigate some of those social determinants of health just by having the insurance benefits such as Medicaid.
Can I add to that as well, Kim, please?
Absolutely.
You hit everything again, like Linda at the top of the conversation. But one thing I do want to point out that we have seen at UPO is food insecurity, access to nutritious food. Once clients are discharged from hospitals, because they don't live in hospitals, they don't live in the facilities that they're receiving care, they need food. So we're seeing heightened attendance at our food pantries, that we recently opened a second food pantry, because there are definitely, if you didn't know, Passaic, the city of Passaic is number 10 on the list of food deserts in the state of New Jersey. We're number 10. So with that said, there's high insecurity levels in the city of Passaic, and we are noticing that more and more at our food pantries. So food insecurities is on the top of the list here. We recognize that is something that we have to really focus on here, and help those that once they're discharged, that the hospitals know how to reach a food pantry to help their clients and patients at need. So we recognize having access to healthy, nutritious foods to keep them healthy. It's something that is definitely a challenge.
Thank you. So, what I'm hearing is, many times in this work, and one of the things the HCPC tries to do is really break down these silos across organizations or needs, because, unfortunately, you could look at it that we're really in the perfect storm of a lot of challenges for populations. We're seeing, the eviction moratorium is gone. Folks are losing certain benefits in regard to food. There's inflation. They may be losing their healthcare coverage. And so all of these things certainly add up and are all connected. I think, it leads to the need for collaboration and good coordination, working together. And so I'm wondering, Linda, if I can ask you, what are some thoughts on how community organizations, providers, payers, policymakers, all of these really important folks who are well-intentioned can work together to mitigate some of these negative impacts that we might be seeing?
Yeah, I thank you for that question, Kim. I think that Janelle gave us a very good example or snapshot of the types of questions she's getting, and the volume of people coming in with just so many hurdles and so many questions. And that echoes pretty well what I've heard in other communities, that a lot of this is going to be person by person with their own personal story and their own personal needs and questions. And so it's going to have to be a lot of different organizations working together. People who are regularly seeing somebody within the medical system, maybe they have a chronic condition, getting those providers to make sure that they have the information about Medicaid, but then also doing warm handoffs to public health, the county, and all of the community-based organizations, either to help the person stay enrolled and then to sign up for all the available other services and supports that they need, is really critical. I also I'm just gonna, as we're talking, share in the chat a great resource that is an organization that's based here in New Jersey, out of Princeton University. They're running a learning collaborative for states across the country, and they have a fantastic website that has resources for states themselves, and as well as these county-based organizations and others. And a lot of it comes down to consumer surveys, getting a really good understanding of how the community wants to receive this information, what's going to be most meaningful to them, and what their challenges are. So I would recommend checking that out for sure.
Thank you so much, Linda. We'll make sure we get that out to the attendees post-call as well.
I add to that as well, to your question and to Linda?
Sure.
Something that resonated with me after a few research, I visited the United Nations this past March and really focused in on the 17 Sustainable Development Goals that was established in 2015 by the United Nations. But I just wanted to point out two of the 17 goals, particularly the sustainable goal number 3, good health and well-being, ensuring that healthy lives and promote the well-being of all at all ages. And lastly, the last goal, 17, partnerships for the goal. So I think we kind of echoed all of those things together, and partnering with like a community action, trusted community action like UPO to get this information out, partnering with Linda, partnering with Joan, and of course with HCPC and getting this information out, becoming that bridge, that conduit to support for sustainability, for a better quality of life for our clients would be very beneficial. I think if we undergird our mission with those sustainable goals, that would definitely be something that would help us to sojourn with our clients that we serve.
Thank you.
Yeah, a lot of other states are using, say, the back to school as a starting point, and then so in that instance, it could be a flyer then from UPO, or whatever it might be, senior lunches at various senior centers, but then having a community-based organization there to answer questions and help with the redeterminations as well as other social services. So I think it's finding people where they are is really seems to always work.
Thank you. And I'm going to keep you on the hot seat for a second, Linda, but in the resource that you mentioned here in the state, and if you have any insight, have there been any best practices or anything that has been happening across the country that we could elevate about the redetermination process? Like what could we maybe put in place, or should we? Any thoughts to share there?
Yeah, so that is really why I put that link in the chat, because a lot of those best practices, like I said, the consumer surveying to really identify how people want to receive this information and what supports they need, and then doing things like connecting it to back to school, and then things like what New Jersey is doing, really having many different avenues to do this outreach. So it's a call center, but then on the website, they have best practices for running a call center and having it in multiple languages, etc. So I definitely would recommend checking that out. And they seem to be updating it pretty regularly. I know the numbers are really small and it's early on in this whole process, but it does seem like states that have a determination to make sure that people are insured are doing much better than other states that are, I'd say, more proactive in terms of removing people from Medicaid. And so New Jersey has seen far fewer people become uninsured than other states thus far, which is good.
Yeah, that's great news. It is very challenging. I know we're doing work with partners and also in coordination with the state to reach out to folks to make sure that they're aware to take the right action here. And one of those things that the HCPC, it's actually interesting, and it's aligned a bit with what you shared, Linda, is we have started to do a recent community poll in partnership with organizations. And in that, we asked, what is a reliable and convenient method for me to receive information about my healthcare coverage? Of the respondents, 53% of the English-speaking respondents said it was by mail. 72% of the Spanish-speaking respondents said that it was by mail. So it's early on in the survey. We're going to continue to move forward and analyze the data that we're seeing. But that method is actually in alignment a bit with what the state's plan is with mailing. Telephone was the second. So it is important to hear and elevate that community voice. Joan, from your perspective in working with the community, what role do you see, do you see this being aligned? Do you see folks who really rely more on technology or digital tools for this process? And then Janelle, I'd like to go to you after, but Joan, from your perspective first, what are your thoughts there?
Yeah, sorry. I think that there is a challenge with some of the digital technology with some of our population. I know in 2021, there was a study that showed approximately 24 million Americans did not have adequate internet for utilizing services. So that ties in again to, if we have patients, especially with our population, they don't have a lot of resources, a lot of income to pay for some of the technology that they might need for internet usage. They're saying most of the studies showing people below the $30,000 threshold are more likely to be reliant on a smartphone, but there may be LTE services as to some of the other higher end internet services that might be more beneficial for them. I think one of the challenges we have, especially with our older population, is digital literacy. And a lot of them don't have the smartphones. They have a hard time with the technology. So that can be a challenge at times. And then also considering cost of technology also is interplays with some of that some of our population may not be able to afford some of the higher end technology. Although I do think it has the potential to make accessing resources and getting information out there, especially about redetermination, more accessible to everyone. But we do find a challenge, especially right now, since Centers for Medicaid and Medicare Services are requiring us to report social determinants of health on our patients starting in 2024. It's mandatory. We had started that process this year. But when we have a positive screen, we need to make sure we are connecting these patients to something. So we're trying to work through that with what resources would be the best thing for these patients. Right now, we're working with HCPC, with their NowPow and their websites to try to have patients access these resources. But what if patients aren't able to get online? And it's kind of a challenge sometimes for some of us. We're trying to work through that.
Thank you, Janelle. How about from your perspective in regard to technology and the folks that you serve? Do you see a lane for that in this process, or?
It's a split. It's a split. We promote a lot on our social media pages and it's shared a lot. We have a lot of traction on our UPO Facebook page and Instagram pages because we're able to see that it's been shared multiple times and we can actually view how many people it reached, that particular post. So we're reaching individuals via technology, but also what's really effective, and we've talked about this before, is the tabling, the face-to-face, the hands-on, the conversations with the community. That has been very effective because it's showing that warmth, that caring, that support, that understanding, that because again, they're distressed because they don't know what's going on. They don't understand. They can't read the application. They don't know where to turn. So calling the 1-800 it's intimidating for some because they don't know what to say or how to explain or articulate themselves to or advocate for themselves of what their needs are. So with that, that face-to-face, that tabling, again, that boots on the ground, in their face type of platform is very effective.
Thank you for sharing. You read my mind. That was going to be my second question. What are some strategies or efforts that you think are working from your experience? Is there anything else that comes to mind? Tabling obviously being number one, face-to-face, interactive, but any other thoughts there? Or needs that you would think to help improve that even more?
We did do some phone calling as well, because we have a database of clients that we serve. So our team are familiar because they're here receiving other services. But again, we provide that wraparound. So we're not just here providing a hand down, but a hand up with a holistic suite of services here at UPO. So with that, we provide phone calls. They pick up the phone because they like, okay, what? It's almost like psychology, Pavlov's the Pavlov dog. And once they hear or see UPO, they're like, what's going on at UPO? So with that said, they will pick up the phone and they're more receptive to receive the information that we have to offer because they know that the information coming from us is valid and secure and they need to take action and so forth.
Thank you.
So
Yeah, we
folks
always
that
talk.
need help.
Thank you. I'm hearing what's coming through is the trusted partnership, right? The grassroots trusted partner organizations. And it's so important once to, maybe hard to build that trust, but once we have it, we need to be very responsible to make sure that we are meeting the needs of the individuals that we're here to serve. I just want to remind the audience, we have a few more minutes for questions and answers. We want to be mindful of any Q&As that folks have from the audience. Let me see. It looks like I have one new message. Okay. I do not have any questions right now at this particular moment in time. So I did want to actually lost track there. Sorry about that. Anything that is resonating with any of our panelists that you want to elevate as I get ready for our final questions here?
Yeah, Kim, I just want to share one other thing. Another law that's really important that changed during the pandemic is a program called Cover All Kids, which allows kids, so people under the age of 19 who are of undocumented status, they are now eligible, if they're income eligible, they're now eligible to be enrolled in Medicaid or NJ Family Care. So that's just something that's important to keep in mind as people are outreaching about re-enrollment. Some people might never, or redetermination, some people may never have been enrolled because they weren't eligible before, but now they are. And so when you think about a family who is mixed status household, it's just really important to share that great information so that more people can sign up.
Thank you so much, Linda, for elevating that. Yes, Cover All Kids, regardless of immigration status, anyone under the age of 19 is eligible for coverage. So really something that we want to advocate for as well. I do see one question. Where can individuals in the community locate community partners who can provide the hands-on support needed? I would share that HCPC is partnering with 7 strategic partner organizations on a program we called Public Health Partners, and it's focused on Medicaid redetermination. We'll be happy to share that information after this call as well. United Passaic organization is one of those, and the others are also listed. It's a combination of faith-based organizations, et cetera. So we'll get that information out to the group. Joan, before we move into kind of concluding thoughts from everyone here on the panel, I did want to ask one question in regard to the role that you see for providers or clinicians in this Medicaid redetermination process. Any thoughts there?
Yeah, and so I guess within the hospital setting, we have such a short period of time when we see patients that there's probably not always the best place. We may not always be aware of when things are occurring. I think education is really important. I know from our perspective with nurse case managers and the social workers, I know we've been working and trying to just remind patients that if you have Medicaid, that this is coming up. I think there is a role for providers when they're seeing patients, if they know that they have this resource, that this Medicaid, and it's becoming, they need to redetermine and kind of have everything relooked at again. An education piece, I think, out in the community from doctors, just as a reminder to them, it's just, this is an important piece. It's part of healthcare. I think that they should be educated at least on this and how it impacts their patients. And I think your primary care doctors have more of a handle on patients because they see them on a regular basis. They're more vested into their health than someone coming into the hospital for an acute event. And I think community physicians should really be partnering with some of the organizations to try to at least have an understanding of how this impacts their patient population and try to at least provide some kind of resources or education if possible when they're seeing them about this.
Thank you so much. We do have one attendee who's raised their hand. I am going to, believe it's Tamar, allow you to talk. If you have a quick question, then we are going to get to final thoughts as we wrap. Tamar, if you unmute, you should be able to ask your question.
Awesome. Thank you so much. Just a quick thought. Thank you so much, Kim and Dr. Hollander and everyone. I appreciate this opportunity and this information that you're sharing. Now, myself and the team, we were partnered with New Jersey Department of Health COVID Community Court team. So similar to some of the work that we do when we're out in the community addressing COVID, disparities and addressing the hesitancy that we observe within the community, one request tends to be requests for health insurance, especially once they see the New Jersey Department of Health. The assumption is that we're also offering insurance. We're also offering information. So the request was just to make sure we have a list of local partners that can help to facilitate this process and just to kind of direct. We did receive, basic information similar to what's being shared as to how we can direct the community. But overall, I appreciate this continuous share so that we have a better understanding of how to address, the changes that are coming, and just continuing to share these resources with the team and, the community makes a difference. So that's just my point I wanted to highlight here.
Thank you so much. And I do just want to share, we did have something mentioning here in the chat, draw folks' attention. So Fidelis Care, formerly WellCare, does have a multilingual community team that can also assist with the renewal process. And there's some outreach information there for folks to take a look at. So I know we're almost at time. I do want to give our panelists a chance to kind of think about as we start to conclude this discussion today, which really is probably just the start. I know this process will be taking place over the course of the next year. Is there one key takeaway or idea that each of you would like to leave with the audience today in regard to our discussion on Medicaid redetermination? I will leave it open to whoever would like to start first. But again, one key takeaway or idea that you would like to leave us with today.
Well, I'll go. I think what we need is really a multi-pronged approach. Somebody just mentioned from the chat, Fidelis, which is one of the managed care organizations. They also have a plan on the exchange. So everybody who's already covered through Medicaid should have a card from their MCO. So it's phone calls and outreach from those MCOs. Joan mentioned the primary care physicians. Everybody is assigned. Everybody in Medicaid has a primary care physician assigned to them. Those practices, reaching out to your attributed patients and making sure that they stay insured, and then trusted community organizations. I think that's the trifecta to really at least connecting in some way with somebody and helping them be redetermined or move over to get covered and get insurance.
Thank you so much.
What I think, although this is a project now of redetermination, we should not stop here. It should be something continuous, regardless of this pandemic wind down. It should be continuous to support the community with their packets, because this is a process that will be ongoing. A redetermination, a renewal process. This is something that should be just continuous. Resources available, supports available, etc. This should still continue as a needed source. Again, I'm still holding on to my SDGs. Goal number 3, ensuring that there's health and well-being for all, and having this resource planted as part of our services and resources will remain.
Thank you. Go ahead, Joan.
Okay. So my background, obviously, is a registered nurse before I became a case manager. So my background, obviously, nursing, and I always think of, especially within dealing with our population here at St. Joseph's Health, is Florence Nightingale's theory that the role of the nurse is to use the patient's environment to help him or her recover and get back to the usual environment. So meaning that the patient's environment can affect his or her health, as evidenced by what we talked about with social determinants of health. So I guess the key takeaway that I would think related to this is just the insurance and making sure patients are covered and have the resources are so important, because healthcare is more than just treating a disease or illness. It's also a social support structure and is an investment in human well-being. And I think by trying to keep, like Dr. Hall has said, boots on the ground, and just keep grinding and making sure that those patients are covered, that they have the resources they need. Because we want to see people flourish. We want to see them be their best selves and have the best quality of life that they can have. So I think really just understanding that healthcare is more than just giving patient a prescription for a pill or giving them physical therapy. There's so much more involved with what their healthcare looks like.
Thank you so much. I think just such an amazing conversation today. You know, it's always a pleasure to work with like-minded individuals that really want to see our communities flourish, as we've all talked about, and how do we work together in order to empower individuals so that they can live their best lives. And that definitely works through addressing the social determinants of health, but it really needs strong partners and communities working together and swimming in the same direction. So I can't thank each of you enough for being strong partners and advocates in this work. Look forward to continuing, moving forward, raising awareness, making some noise about the fact that this is happening so that folks can really be well positioned to retain their healthcare coverage either through Medicaid or obtain it through the exchange, so that together we can really ensure that folks have the opportunity to live those healthy and prosperous lives where we work. I think we will likely conclude a little bit early. I would like to also thank the audience for joining us today. This is the third Roundtable series. Look out for more as we move forward. I believe next is something we'd like to start talking about with mental health. So be on the lookout for another Roundtable series with expert panelists to discuss that topic and the impact here within our region and beyond. Again, thank you so much. Really has been an honor and a pleasure to have you here for this conversation today.
Thank you for having us.
Thank you very much.
Thank you.
Bye.
Thanks, everyone. Bye-bye.